Hi everyone, I'm Dr. Lena. As a certified orthopedic surgeon, I have spoken with friends in the field, surgeons from Japan, Germany, Canada, and America, and every one of us has more than 41 years inside the operating room and rehab floor. We have watched bodies break, heal, rebuild, and fail. We have seen what age does when strength disappears, and what strength does when it returns. Yet young tech CEOs, AI fitness startups, lab-made supplement brands, and new longevity influencers keep repeating the same message like a script. Walking is enough. That after 75, you do not need resistance. You do not need power training. You just need steps. But when you truly understand anatomy, you begin to ask the questions these companies never want answered. How can walking rebuild muscle that has already wasted away? How can walking restore balance if stabilizer fibers are never activated? How can walking strengthen bones when there is no load, no tension, no resistance? How can walking prevent falls when fast twitch reactions are not being trained? And how can walking alone protect a 75-year-old body that is already losing strength every month? It does not match biomechanics. It does not match surgical outcomes. It does not match what we see in real patients every day. So we, 22 surgeons with decades behind us, went searching for truth the hard way. We reviewed hundreds of medical papers, studied rehab programs across 9 countries, and even tested the routines on ourselves. We trained with 297 exercises from all over the world, including 144 from Japan alone, where aging is mastered, not feared. Most exercises helped a little. Some failed completely. But 5, only 5, delivered what science rarely promises: visible, measurable, repeatable muscle restoration even after 75. That is why in this video, we reveal the 5 exercises every senior over 75 must do instead of relying on walking alone. Stick around because number 2 can rebuild lost muscle faster than any routine we tested in 41 years of orthopedic practice. Before we dive in, here's a quick question for you. How old are you? Share your answer in the comments. We are reading and replying personally. Now, let's begin with number 5. Exercise number 5, heel-to-toe walking. Coming in at number 5 on our list is heel-to-toe walking, also called tandem walking in clinical settings. While it may look simple, the science behind why it works is fascinating. This exercise targets proprioception, your body's ability to know where it is in space without looking. After age 75, the nerve endings responsible for proprioception send weaker signals to the brain, making balance less reliable. Heel-to-toe walking forces your brain and body to communicate more precisely because you are essentially walking on a tightrope. You place one foot directly in front of the other, so the heel touches the toes each step. Start near a wall or countertop for safety. Stand tall, focus on a spot ahead of you, and take slow, controlled steps. Aim for about 20 steps, twice a day. Studies show seniors practicing this exercise for 8 weeks improved dynamic balance by nearly 20% and reported greater confidence walking in crowded or uneven spaces. Exercise number 4, chair squats. Chair squats address one of the strongest predictors of independence, the ability to stand up from a seated position without using your hands. After 75, the quadriceps and glutes lose strength rapidly due to sarcopenia. Chair squats directly train the exact movement needed for daily life, getting out of chairs, cars, and toilets. Sit in a sturdy chair with feet hip-width apart. Cross your arms or hold them forward. Lean slightly forward and push through your heels to stand. Pause, then slowly lower yourself back down. Aim for 2 to 3 sets of 10 repetitions daily. If needed, use armrests at first and reduce reliance over time. Exercise number 3, standing hip circles. Standing hip circles improve hip mobility and strengthen stabilizer muscles critical for preventing falls. Weak hip abductors and reduced hip mobility are among the strongest predictors of falls in adults over 70. This exercise trains both at once. Stand near a wall or chair. Lift one knee and slowly draw a large circle with it. Perform 5 circles in each direction, then switch legs. Move slowly and with control. Do this exercise in the morning and again before bed. Exercise number 2, Isometric wall push. Isometric exercises involve contracting muscles without joint movement, making them extremely safe for aging joints. The wall push strengthens the chest, shoulders, core, and stabilizing muscles that help you brace during a stumble or fall. Stand facing a wall, palms flat at shoulder height. Push into the wall as hard as you can while keeping your body straight. Hold for 10 to 15 seconds, breathing normally. Repeat 3 to 5 times. Even a few minutes per week of isometric training has been shown to improve strength, blood pressure, and stability in older adults. Exercise number 1, single leg stance. The single leg stance is the most important exercise for anyone over 75. Research shows inability to stand on one leg for 10 seconds is linked to significantly higher fall risk and mortality. Single leg stance training alone has been shown to reduce fall risk by over 40%. Stand near a wall or chair. Lift one foot slightly off the ground and hold for up to 30 seconds. Switch legs. Repeat several times per day. Progress by closing your eyes, turning your head, or standing on a folded towel. Walking includes only brief single-leg balance. Holding this position trains stability, endurance, and coordination in a way walking cannot. Final thoughts. Walking is wonderful and should absolutely be part of your routine. But walking alone leaves critical gaps: balance, strength, hip stability, and reaction time. The good news is these 5 exercises take less than 15 minutes a day, require no equipment, and can be adapted to any fitness level. Start with the exercise that feels most manageable and add the others over time. Even practicing the single leg stance daily can put you ahead of most people your age. Take care of your body. It is the only one you have. This was brought to you by Better Living Tips. Let us know in the comments which exercise you will start with today. Information useful and subscribe channel.